Okay, right. Some of you may have heard that economics has been referred to as the dismal science. It's the sort of epithet that's used again and again, the dismal science. And this quote comes from Alan Williams. He argues health economics is the cheerful face of the dismal science. Now, this description, dismal science, first of all, quite nice to have economics regarded as a science. I'm not sure it is, but let's focus on the dismal bit. This description actually comes from Thomas Carlyle, and it is widely believed that he was responding to the gloomy predictions of economics. The idea that, this is going back in time, that the population will always grow faster than the supply of food. And this seemed to be one of the messages back then coming from economics. And it was thought that's why he called it dismal, that it seemed to not be a very happy story. But in fact, if you look at the history of it, that's not where the dismal bit came from at all. It's an early form of propaganda. And it was an attack on economics from those people who didn't like the position economics was taking on slavery. And there were people who were against the emancipation of slaves, and they saw economics and economists as being against that system and trying to, as it were, free the slaves. Economics were preaching, and economists preaching principles of equality. And so I think if that's the reason it was called dismal, I think it's quite nice to be dismal if you're preaching equality. However, I can also see why people were very ready to accept that economics might be the dismal science, because economists are always emphasizing scarcity. We've got limited resources. Economists are always emphasizing opportunity cost. If we do this, we can't do that. So economists are always emphasizing sacrifice. And, well, while we're all aware of it, maybe we don't want that to be pushed in our face all the time. But I should stress that while it's true that economics does emphasize opportunity cost, the benefits we forego if we take an alternative course of action, while that's true, it's really important to emphasize that health economics is nothing to do with saving money. It's not at all anything to do with saving money. What health economics is concerned with is improving the quality of people's lives. Now that's going to take money, and the money you spend improving the quality of people's lives is taking away from somewhere else. But we're not, in health economics, concerned with saving money. Quite the reverse, we want to spend money to get benefit. But the key thing is, when you spend more money to get more benefit, you want to be sure you are getting more benefit and you're not losing more elsewhere than you're gaining. That's the key thing. You always want to, if you're going to do something new that brings benefit, that's great. Just be sure you're not losing more elsewhere. So how might health economics improve health and healthcare? Well, I think there's one main way in which health economics can help, and that's in understanding behaviour. Now, it might be the behaviour of consumers. As I say, for example, consumers, their utilisation of health services, or it might be their consumption of things like tobacco, or it could be their consumption of gym memberships, things like that. Their consumption of cycle trips, beneficial things. I was walking along the river this morning and I was struck by how many cyclists there were and pedestrians. And well, that behaviour, that decision to cycle or to walk, not to take the bus, not to drive a car, well, that is just a standard economic decision with lots of factors influencing it. Level of income, how much time you have available, what the alternative opportunities are in terms of public transport, private transport. But these sorts of things are all susceptible to traditional economic analysis. And so, health affecting behaviour, just like any other decision that we make, in principle, can be subjected to economic analysis. It's not just the behaviour, however, of consumers, or sometimes call them patients. It's also the behaviour of healthcare providers, those people who are supplying the healthcare. So one big area of health economics has been to look at financial incentives for different providers, particularly doctors, and to what extent medical doctors respond to financial incentives. Now that's fascinated economists because there's a little bit of an idea out there that medicine's a vocation. And while I can see it can be to some extent, that doesn't mean these individuals who've chosen, some of you who've chosen medicine, it doesn't mean that you aren't sensitive to different sorts of incentives, for example, financial incentives. Your behaviour may still be influenced by such things as money. We'll have an example of that in a minute. It's not just individual providers that respond to incentives, organisations also respond to incentives. And there's different, for example, there's different ways that we can reward hospitals for the care they provide. I'm woefully ignorant about how it's done in Japan. I don't know, you might have a sort of DRG system, a lot of the world does. But, well, if you pay hospitals that way rather than some other way, you get different behaviour. And studying these different behaviours is an interesting part of health economics. Now, does anyone know what this is? Maybe you're a little bit too distant. It's a man's body, yes. Most recognisable, I think, is that's part of the nipple in English. I think there's a belly button lurking here. Now, I saw this. It's not a selfie, by the way. I saw this on a bus shelter in London. It was part of an advert. And save the male, well, it's a sort of play on words. In countries other than Japan and Norway, we have some sort of emotional attachment for some reason to whales. And so Save the Whale is a sort of campaign. And so this campaign wasn't anything about marine mammals. This is Save the Male, and it was a campaign to highlight men's mental health, because young men and middle-aged men in particular are subject to quite a lot of mental health problems which they frequently don't seek help for, and they feel less able, shall we say, than, for example, their female counterparts, less able to when we recognise there is a problem, and to seek help. And so this was trying to raise awareness about men's mental health. I include it though, however, because what it makes me more think about is not the mental health of men, but obesity, because that looks quite an impressive, yes,